Let's talk about Isolite sizing and placement, which is really important. We use our Isolites all the time in our offices for treatment. And the first thing I want to talk about is the different sizes we have. We have 4 sizes in the office. We have a pedo, we have a small, we have a medium, and we have a large, okay? And they really differ in size tremendously, all right? As far as how to decide what size you should use in a patient's mouth, a lot of it's based on both the size of their mouth, their age, and the treatment that we're doing. And it's kind of an art in picking out the right size. So typically, if we're working on a baby tooth, on a young patient who is probably, doesn't have their adult teeth in, we're always going to use a pedo size, all right? So any kid who doesn't have adult teeth, you can pretty much count we're going to use a pedo for sure. Now, once kids start getting their adult molars in, though, that's when we start needing bigger sizes to get farther back. And so if we're planning on using an Isolite on a patient who needs their first molars sealed, the first molars typically need at least a small to be able to reach that far back. You can probably make a pedo work if you really had to, but a small is definitely going to be much easier, all right? So if you're working on tooth number 3 or tooth number 30, you're probably going to want a small size Isolite to use. Now, once a patient gets their second set of molars, so one's even farther back, again, we need an even bigger size, and that's when we have to start using medium sizes. So if you have a teenager who is going to be getting, sealants on, number 2 or number 15, having that medium is really, really helpful. Now, so not all teenagers can have a medium fit, and you might have to, again, stretch a small, but a medium is the one I would probably go for any second molars you're using, all right? Then you've got patients who are just big old teenagers and big old mouths, all right? Some adults that might need a large. Those are the ones we use the least frequently. But if you just have a patient who've got really, really big mouths, using that large might be what you need to get everything back there as far as you need to. So that's how we pick out our sizes. And it's kind of looking at a patient, assessing the teeth, what we're treating, what age they are, to kind of make your best guess. And it might be that we need to modify it. We might have to use our scissors. We might even change sizes. So just ask the doctor if that's something you want to do. Now, as far as placement goes, this is the best way to place an Isolite. When it comes to our patients. It's a big old piece of chunk of rubber here. So what we have to do is we have to find a way to get this to fit in their mouth comfortably. And it goes in there comfortably as long as we slip it in the right way. Now, a mouth, you can see, of course, goes from this left to right. It's good. The opening is this way, and then it turns into a hole when we open up all the way. Now, it doesn't make sense, of course, for us to put it in this way. But so we want to go in this direction because it's shaped the way our mouth is. But the even better thing to do is to turn it sideways. All right, so when a patient opens, the first thing I do is I take the bottom fin, I take that and I slide it underneath their bottom front teeth, and then I take my finger and I push down the top like this, and then I tip it back so it slides in under there, and then I let my finger out. I take the tail, I push it back in the back corner, and then I tuck it into the cheek. And then the last thing I'll do is I'll worry about the back side, run my finger around and put it in just like this, and make sure that it's comfortable on both sides, okay? Let me do that one more time for you. Again, do the bottom, slides in behind, pinch it down with your finger, slide it in, let go, tuck your tail in, and slide over and in, all right? And that's usually the quickest and easiest way to get an Isolite into a patient's mouth, with hopefully being as comfortable as possible and getting to that comfortable spot, all right? I'll slide that back down. Of course, taking out, you kind of do the opposite. You're gonna pull it down, slide it all out, and come forward. And of course, there's usually spit. You want to catch that, and then away it goes, all right? So there's a little bit about Isolite placement and sizing, hopefully to help you all as you're trying to make those decisions and also get an Isolite into a patient's mouth. Thanks a bunch.